The number of women using opioids in pregnancy has increased in part because it's been increasing in the population more broadly. Over the last decade, there's been a fourfold increase in prescriptions written for opioid pain relievers, and now we see a massive increase in complications from opioid pain relievers. It's beginning to affect every part of society, including pregnant women and their infants. The number of infants experiencing drug withdrawal has grown nearly fivefold over the last decade. In 2012, there was about one infant every 25 minutes born in the United States having drug withdrawal, a massive increase from just 15 years ago. In response to the massive increase of opioid use in pregnancy and infants with drug withdrawal, states have responded in different ways. And some states have responded with laws that criminalize opioid use in pregnancy. And it results in women being arrested. One of the worries that we have within the American Academy of Pediatrics is that this drives women away from care. The policy statement proposes a public health approach to opioid use in pregnancy and neonatal abstinence syndrome, or drug withdrawal in newborns. And it begins with prevention. How do we prevent unnecessary effects on mom and baby from opioids, and promote treatment? We also propose increased funding and support for systems that are safety net systems, like the child welfare system throughout the United States. I think we need to realize that opioid use disorder is a clinical problem. It's not a moral failing. And as we begin to step back on how we approach this massively increasing problem of opioid use in pregnancy and infants having drug withdrawal, we have to understand and approach it in a way that involves science and public health, not in overly punitive approaches that may be ineffective.